There's new evidence suggesting that military members who experience harmful exposures during service could be prone to higher risks for mental health, chronic diseases, and mortality. That's according to a new investigation co-authored by Jeffrey Howard. He's associate professor at the Department of Public Health at the University of Texas, San Antonio. Jeff, welcome to the program.
Well, thank you very much for having me.
So how much higher were the mortality rates for post-9/11 vets who had experienced traumatic brain injury?
Well, they were significantly higher, and it varied by cause of death, obviously, but in some cases they were twice as high.
So then, but why? What was the cause of that higher mortality?
Most of it was caused by accidental death and suicide, but we also found that essentially all causes of death had excess deaths that were attributable to them.
So this, when you say accidents and suicide, was that directly attributable to the traumatic brain injury?
Well, it's hard to say exactly. We know through the data that we have access to that those individuals had been diagnosed with a TBI. It's hard to say exactly how that connected to their death. What we do know is that in comparison to rates of accidents and suicides in the general population, that these individuals had much higher mortality rates from these causes.
I wonder if you factored in the severity of the traumatic brain injury.
We did. We looked at both what we call mild TBI, which would be like a concussion, and then we compared those to individuals who had what we refer to as moderate to severe TBI, and the moderate to severe TBI had much higher mortality rates across all causes of death.
Was there higher mortality among vets who did not experience traumatic brain injury? Did you look at that?
We did look at that. So vets that did not have any exposure, or at least any known exposure to TBI, still had excess deaths or higher mortality rates, if you will, from accidents and suicides, as well as homicide.
You know, there are about 1.8 million post-9/11 military veterans with service-connected disabilities. It's much more than previous wars. How have vets fared in these post-9/11 wars compared to previous wars?
Yeah, that's a great question, and that was one of the motivators behind this study is, after previous wars, particularly World War II, Korea, and Vietnam, there have been studies done that showed that veterans had less mortality than the general population, in particular with cardiovascular disease. This was called the healthy soldier effect. And so we wanted to see if there's any degradation in that for these post-9/11 veterans. And what we found is that there is, in fact, been sort of a reduction in this healthy soldier effect to the extent that veterans overall, regardless of their TBI exposures, are having higher mortality.
So what did you find in terms of the direct effects of PTSD and depression?
Yeah, in this particular study, we did not look at that specifically. We have investigated that in prior studies, and that does show that there's a linkage between PTSD and mortality, as well as other chronic diseases. We've looked specifically at the linkage between PTSD and increased risk for cardiovascular disease specifically, and we have noted that the risk for cardiovascular disease are much higher in individuals who have been diagnosed with PTSD.
You also noticed higher deaths due to cancer. Do you know why?
Yeah, that's a good point. We don't exactly know why. I mean, we have some hypotheses. This was really a pretty descriptive study, mainly just to look at the overall trends. And now what we're hoping is with this increased awareness, that with the fact that there's increased mortality across many different causes of death, that we need to now focus in more specifically on what what all the factors are that are actually leading to cancer deaths. And for example, at this point we really don't know. We suspect that there are some harmful exposures, such as environmental exposures, that we were not able to measure in this particular study, but that that's one of our that's one thing that we suspect.
And burn pits as well.
Correct.
Jeff, can you tell us a little bit about how you conducted the study? In other words, how many vets were studied and the diversity of the sample?
Sure. Yeah, we followed roughly 2.5 million veterans. The data were compiled from both the Department of Defense and Department of Veterans Affairs databases. And we were able to link those data to what's called the National Death Index. And that's how we were able to ascertain the deaths in the population. And so the study followed these individuals from 2002 through the end of 2018. So it's a pretty long period of time that we were able to measure the mortality in this population.
All right, well, Jeff, I appreciate your work on this, and thank you so much for being on the program.
Well, thank you so much for having me. I appreciate it.
Thanks for watching. If you enjoyed the video, give it a thumbs up and subscribe to our channel so you don't miss out on any future Government Matters interviews.